Hello everyone. In this video we are going to learn about anatomy of anal canal. Anal canal is the terminal part of large intestine. Okay. So descending colon will be there, then sigmoid colon, then rectum, then finally this is the anal canal. So this is the terminal part of large intestine which measures approximately 3.8 centimeter in length in adults. Even though this is a part of large intestine which lacks the cardinal features of large intestine, it is a gross appearance that includes appendices epiploicus, tinea coli and circulation. These things are absent in the anal canal. It is also absent in the rectum, which is surrounded by, the anal canal is surrounded by two sphincter, which is controlling the continence of the anal canal. So those are the internal and the external anal sphincter. So this is the internal anal sphincter and this region is the external anal sphincter. So which is the important for maintaining the continence of the anal canal. So we are going to discuss the anal canal under the following headings. First, let me start with the location of anal canal. Anal canal or the anal opening located in the posterior anal triangle of the perineum. The whole perineum is diamond-shaped structure by using the landmark anteriorly pubic symphysis, posteriorly coccyx, that is the tip of coccyx. On either side, this is the ischial tuberosity. So this whole diamond-shaped structure is divided by the horizontal imaginary line passing through the two ischial tuberosity. Anteriorly, it forms the urogenital triangle. Posteriorly, anal triangle. So this anal canal or this anal opening located in the posterior triangle. On the either side of the anal canal, there are the ischiorectal fossa, and you all know this is the continuation of rectum. So this anal canal extends from anorectal ring to the anal opening or anal wedge. This anorectal ring, this is formed by the puborectalis. So this one we have already seen discussed in the rectal class. I'm giving the link here. You can go through it. So this puborectalis sling pulls the anorectal junction forward so that the whole course of the anal canal will be backward downward. Okay, so because this is the coronal section, in the sagittal section if we see, so the rectum and the anal canal, it will be pulls forward, okay, by means of the puborectalis sling. Okay, from the pubis bone, this puborectalis muscle pulls it forward. So this is the location of the anorectal ring. So from here, it, the course of the anal canal will be downward and backward. If you closely observe, in its lower part, even the skin of the anal opening will be having some kind of wrinkling like appearance. This is because of the corrugator cutis ani muscle, which is a subcutaneous muscle. Because of its tone, the anal opening appear to have lot of wrinkles. Moving to the relation, anteriorly it varies from male and female. In the female, anteriorly The anal canal will be related to the perineal body and the lower end of vaginal canal. In males, anteriorly it is related to again the perineal body, bulb of the penis and the spongy male urethra. Posteriorly, in both male and female, it will be related to the tip of the coccyx, then the anal raphe. On either side, the anal canal is related to the ischial-anal fossa. So this will be helping in the distension of the anal canal during defecation. Moving to the interior of anal canal, this is important. You will be getting a lot of MCQ also in this area, that is the interior of anal canal. This anal canal interior is roughly divided into two parts based on the location of this pectinate or dentate line. Okay, so this will give some tooth-like appearance. Pectinate or dentate line, the upper part and lower part. The upper part is smaller, that is 15 millimeter in length. The lower part is 23. So total around 3.8 centimeter. Okay, so the upper part is 15 millimeter, the lower part is 23 millimeter. So this upper part consists of anal columns. Okay, so these are the vertical permanent mucosal fold. Around 6 to 10 anal columns will be there, vertical folds, so which will be uh, running from above and terminating close to the pectinate line. The adjacent two anal columns will be connected by the means of anal valves. Okay, so this concavity is towards upper part. So here the free edge. These anal valve, the series of anal valve throughout the anal canal combines to form this pectinate or dentate line. So in between, actually these anal columns are projected forward. As I already said, this is a permanent longitudinal folds. Within the folds, it contains actually the radicals of the superior rectal vein. Okay, so within this column, there will be radicals of the superior rectal vein. So these are the elevated structure. So in between these two anal column, this depressed area, okay, so this depressed area is known as anal sinus. The tubular glands of the anal canal, those will be opening in this anal sinus. So what are the point we have discussed in the upper part? So it contains anal columns, those are the permanent vertical folds. Then these two, each two adjacent folds will be connected by a valvular or concave structure. So that is the anal valve. In between the two columns, the depressed area is known as anal sinus. Okay, so this pectinate line is believed to be a part where the embryological part of anal membrane is located. Okay, so this upper and lower part has the there are different characteristics. If you see the upper part, this is endodermal in origin. The lower part is ectodermal in origin. As this is endodermal in origin, so this receives the nerve supply, that is again the autonomic nerve supply. The lower part will receive the somatic nerve supply. The upper part is drained by the tributaries of portal vein. The lower part is drained by the tributaries of systemic vein. So this is a site of portosystemic anastomosis. So moving to the lower part, so this lower part is further subdivided into again upper and lower. This upper is known as upper part of this upper region of the lower part of the rectum is known as pecten. This this demarcation is done by a line known as white line of Hilton. Okay, so this is a kind of demarcation between the mucous membrane and skin. This pecten contains the kind of mucous membrane. Here below this white line of Hilton, this is lined by the skin. If we see the lining epithelium of throat, the upper part contains the lining epithelium. This is the simple columnar epithelium. This pecten is lined by stratified squamous non-keratinized epithelium. So this lower part of this below the line of Hilton, it is lined by the stratified squamous keratinized, nothing but the skin. Okay, so this is a transition happening. Above the pecten line, this is a simple columnar. From the pectinate line to the white line of Hilton, this is the stratified squamous non-keratinized. Below the white line of Hilton, this is the stratified squamous keratinized, otherwise known as skin. So this is a transition which is gradually happening. If you see this below the white line of Hilton, this part is lined by the skin and which is quite dark to brown in color, which is continuous with the anal orifice with the skin or the gluteal region. So this is the same interior of anal canal image, which is closely similar to its gross anatomical appearance. Here you can able to see this is the dentate or pectinate line clearly, and these are the longitudinal permanent mucosal fold, otherwise known as the anal columns. Okay, so and these are all the valves which is connecting anal valve which is connecting between the two columns, and as I already said, these are the elevation formed by the radicals of the superior rectal veins. In between these elevation, these depression are known as anal sinus, where these glands you can able to make out anal glands. These tubular anal glands will be opening into the anal sinus. Okay, so this is the upper part. When coming to the lower part, in the lower part there is some transition which is happening. So this is exactly located in the lower part of the internal anal sphincter. Here you can able to see this is the internal anal sphincter. In its lower part, around here you will be having that white line of Hilton. Okay, so in between the pectinate and white line of Hilton, this is known as pecten, which is lined by the mucosal membrane. Okay, stratified squamous non-keratinized epithelium. Just below this, just below the white line of Hilton, this contains the stratified squamous keratinized, otherwise the skin. Moving to the anal sphincter, this anal sphincter is, as I already said, it is divided into internal and external anal sphincter. This internal anal sphincter is located interiorly close to the lumen, and external is just covering the internal anal sphincter. This internal anal sphincter is formed by the thickening of circular muscular layer which is deriving from the large intestine, that is mainly from the rectum. Okay, so this is an inner circular layer. In its course of the anal canal, it became thickened to form the internal anal sphincter. If we see the external anal sphincter, this external anal sphincter is a complete covering of the interanal sphincter throughout its length, and it extending beyond this part also. So this external anal sphincter is divided into three parts, that is deeper part, superficial part and subcutaneous part. So all these sphincter, internal external, is arranged in a circular fashion so that it will be constricting the anal canal except during the defecation. And this internal anal sphincter is made up of smooth muscle. Okay, so this is not under our control. This is involuntary in nature. And this external anal sphincter is made up of striated muscle, that is a skeletal muscle, so which is within our control. If we see the breakup of external anal sphincter, as I already said, this is divided into deep part, superficial part and subcutaneous part. So this deep part is circular in nature. It doesn't have any bony attachment. This is closely related to the anorectal sling. So usually it may be merged with the part of anorectal sling in its posterior aspect. This is an anterior pubic symphysis, posteriorly the sacrum. So in its posterior aspect, this deep part might be merging with the anorectal sling, that is with the puborectalis muscle. So this middle part, this is elliptical or oval in shape. Anteriorly, it will be attaching with the perineal body. Posteriorly, it is attaching with the anococcygeal raphe. Usually, this perineal body attachment is considered as an insertion of the superficial part of external anal sphincter. So, it has the attachment on the either side, anterior and posterior. Coming to the superficial part, again, it is a circular layer which is encircling the lower part of the anal canal, and this is subcutaneous in nature. In the location of superficial anal subcutaneous part of anal sphincter, external anal sphincter, there won't be any internal anal sphincter. In these location, that is in just deep to the deep part of external anal sphincter and the superficial part of external anal sphincter, there will be continuation of internal anal sphincter. Moving to the blood supply. So this we have discussed already in the rectum. So this is the superior rectal artery, which is a continuation of inferior mesenteric artery. This supply up to the anal canal, up to the level of dentate or pectinate line. Okay, so the upper part is supplied by the superior rectal artery and the lower part is supplied by the inferior rectal artery, which is the branch from internal pudendal artery. So this is the demarcation. So above it is supplied by the branch from the inferior mesenteric artery, because the upper part of the anal canal is developed from the endoderm, that is the hindgut. So it is supplied by the branch from the inferior mesenteric artery, that is the superior rectal artery. The below is ectodermal in origin, so it is supplied by the internal branch from the internal pudendal artery, that is nothing but the inferior rectal artery. So similar to the arterial supply, the venous drainage above the pectinate line. Again, this is a superior rectal vein which drains into portal vein. Below the pectinate or dentate line, the lower part is drained by the inferior rectal vein, which is drained into the systemic vein, which is nothing but the internal pudendal vein. So this is the site of portosystemic anastomosis. So we have discussed the plexus, venous plexus, which ultimately leads to the internal and external hemorrhoids in the rectal video. Coming to the innervation, so again, based on the dentate line, the upper part is, as it is derived from endoderm in nature, so this is getting the autonomic nervous supply. Below it, this is the somatic. If we see the sphincter, say the internal anal sphincter is supplied from the autonomic nervous system and external is from the somatic. So the external anal sphincter receives the nerve supply from the inferior rectal nerve and the fourth sacral nerve. So this is voluntary in control. The external anal sphincter is voluntary in control. Again, same, this dentate line is a watershed line. Above that, this will be drained by the internal iliac group of lymph node. Below the dentate line, this is drained by the superficial inguinal group of lymph node, particularly the horizontal part. Okay, so the superficial inguinal lymph node having the horizontal and the vertical part. In that horizontal part will drain the lymph from the anal canal, which is below the dentate or pectinate line. So we will discuss the surgical spaces around anal canal and the applied aspects in the another short video. Thank you.